I'm here with China Robertson, who is a local licensed acupuncturist and herbalist who has been treating people for maybe over 28 years. And she does it with incredible dedication and many tools. So China, when someone comes to you, what do you do with them?
Well, first I talk to people on the phone and see if I'm the right fit for them, and then I invite them to come in for an in-depth intake consultation where we actually share some tea and fruit and really get to know each other. And we use the format of a intake form that discusses where they are now and where they've been and where they'd like to be. A lot of people come in like for a symptom, but basically underneath that I find that the symptom is what gets them here, and then I can work on the deeper underlying layers of what their imbalance is or what their constitution is, as well as prevention.
So a lot of people are turning to acupuncture for pain relief. What do you mostly see people for? Is it for, pain relief is a big part of it, I would imagine.
Actually, that's probably not such a big percentage for me.
Okay.
I see a lot of people that have terminal illnesses or infertility issues, menstrual regulation, depression, stress, arthritis, cardiovascular disease, cancer.
That's a very long list.
A wide range of things. I basically try to be available to have more like an old family practice style where I get to know people and their spouses and their kids and their animals, and we kind of treat the whole package instead of just going in one specialty, which a lot of really good acupuncturists do. But I like to include all of it.
And I'm sure you do with your clients, or your patients, I guess they would be completely called. What other things do you bring to your practice that others don't bring to their practices?
Well, I have studied with some very notable professional acupuncturists from this country and from Japan and China, as well as I've done a lot of work with some Tibetan Buddhist spiritual teachers. And so combining that training, as well as I originally did undergraduate and graduate work in psychiatric hospitals and human development. And I've been doing a lot of studying with the Taoist practitioner, master. He's kind of considered the acupuncturist of the United States.
Wow.
And so from him I've gotten a more aesthetic background that kind of reflects my own personal style of using stone medicine, and I do ion pumping cords, which comes out of Japan from Kiko Matsumoto, and a lot of herbs and botanical formulas and essential oils and things that just stand alone. I really find that the tools are a way to just bridge my ability to try to provide a really open place for someone that feels safe, that they can open up their mind and their heart and their spirit. And sometimes I think it's just feeling like someone's holding you energetically, and that someone cares about you and they listen to you. And I think that motivation of the practitioner and the patient is at least 70% of the healing. That's what I've decided after my, couple decades of being around people. And I get a lot of passion and joy from it. So I really want to help people, and people that are highly motivated and really want change, they go through things quickly. Other people, they kind of want it done for them, still more in the Western model. So I do the best I can to meet people where they are, and so they can go as more superficial or as deep as they'd like to, if they just want to fix a problem or they actually want to really change their life and become everything they can be.
Well, it sounds like you really empower your patients, and that's wonderful for people to hear.
I hope so, yeah.
Well, thank you, China.
Well, thank you, Susie, very much, and thank you for your contribution of our Insight webpage and our directory.
Oh, you're so cute. You're welcome.
Bye.